Obesity affects roughly 42% of U.S. adults, two-thirds of which say willpower alone isn't enough to shed these extra pounds. Hence, the exploding trend: 4 out of every 10 people who are taking semaglutide drugs like Ozempic and Wegovy to lose the weight. But a disturbing report is exposing a dangerous trend: unauthorized and potentially harmful ingredients in knockoff weight loss drugs. Here to share more is Shabir Imber-Safdar, Executive Director at the Partnership for Safe Medicines. We're so glad you could join us today.
Thank you. Thank you for having me.
4 out of 10. I think we're separated by a degree of separation when it comes to people we know who are taking these injectable weight loss drugs. This is crazy.
There's quite a lot of it happening, and it's understandable because these are powerful medicines that can have life-changing effects for people struggling with obesity. But it's also become a little too easy to get access to these medicines without sufficient medical supervision.
And that's a big component of this, is that people are ordering these medications and they self-inject at home. Is that right?
Yeah, and you can do that under the care of a doctor, but people are often buying these from unsafe sources, or they're buying compounded versions which are not the same and equivalent like a generic to the branded products. And there's additional risks that they're not understanding that they're taking.
So what is the safer route if you're going to commit yourself to taking these weight loss injectable drugs? Where do you find them, the safe ones, and where are these counterfeit ones slipping past inspections and ending up in the hands of consumers?
So what we found when we studied import records from the FDA was that there are people outside of the US sending in these injectable weight loss products that have never been made at an FDA inspected facility. And usually, quite often, they get stopped by customs, but we found 239 shipments that were very disturbing that had come from facilities, including one claiming to be a JW Marriott, that were attempted to be shipped into the country. And we're really worried because some of them were marked as ingredients for compounding. And most compounding pharmacies don't tell you what FDA inspected facility they get their ingredients from. And so we're pretty concerned that these found their way into compounded weight loss medications.
Are they packaged as an off-label, or are they bearing the names, these brand names that I mentioned earlier?
We have seen some perfect look-alike counterfeits of brand name products. But what we studied in this particular research report was ingredients for compounded medications and other not name brand versions.
And what are some of the dangers of, let's say you end up getting a counterfeit drug in your hands, you inject it into your body? What is it that you're potentially injecting, and what could happen to you?
Well, the answer is it could be anything, and that's really the risk, because when you inject something and it may have gotten, let's say, tainted with meningitis or some bacteria or virus that was in the supposedly sterile room that wasn't sterile. When you inject it into your body, it basically, puts you at risk of serious illness or death.
That is frightening.
It is frightening, and these injections have to be sterile. They have to have enough active ingredient. They have to have a consistent amount of active ingredient for you and your doctor to be able to accurately assess your ongoing health when using them, because they are serious medicines.
What is incentivizing people to go that route? Why aren't they just contacting their doctor and paying the price? Are they getting it cheaper?
I think some people think that they're getting a bargain, but the FDA has been very clear: compounded medications are a last resort, not a first resort. And so we're seeing a lot of people taking a risk with getting a medicine that's not been approved by the FDA, not realizing that comes with it a lot of safety risk. So I think a lot of times it's driven by lack of insurance coverage, which is a real crime. Insurance should cover any medication that has the potential to help you actually deal with obesity, which is a very serious disease. But when insurance doesn't cover it, people are left desperate.
Sure. And to talk about some of the costs, it's about average $850 per month for these injectables. If you go without insurance, $25 in certain cases. If you do have insurance, it's different for everybody. But really, your health is priceless. So you don't want to play Russian roulette with your health. And so what is the U.S. doing? What is this country doing to ensure that these medicines don't get past our borders and into the hands of consumers?
So the FDA has a pretty active inspection program, both inspecting the facilities that make the ingredients, and then they have inspectors at the border, which enforce our pharmaceutical border security to ensure that medical products that come in are actually from FDA-inspected facilities. But beyond that, they do prosecute people who sell products online that are not safe. And they do inspections of compounding pharmacies and compounding outsourcing facilities. And sometimes they find pretty serious problems.
I see. Well, this is something we're going to keep our eye on. Really important stuff. And you got to police yourself. You have to make sure that you're going through the right routes. Just a quick question. Are most of these counterfeit drugs coming from offshore, or are any of them domestically created?
So the lookalike counterfeits do come from offshore, and the unsafe ingredients for compounded medications do come from offshore. But primarily, when you're looking at a compounded version of a brand name product, it's being made here most of the time.
I see. Okay. Shabir, thank you so much for joining us. We really appreciate your time.
Thank you.
We're back after this.